All right, everyone, my name is Giovanni. On behalf of Carousel Technology, I want to welcome you to today's webinar, Leveraging Practical Tools to Manage Opioid Settlement Funds and Heal Communities. And with that, I'll turn it over to one of our hosts of today's webinar, Denisha Alikak.
Thank you. Thank you, Giovanni. Depending on the time of day where you are watching this, good morning, good afternoon, and good evening, everyone. I'm Dr. Denisha Alikak, the Public Health Strategist at MTX.
And I'm Amanda Tate, Vice President of Health and Human Services at MTX.
We're excited to be your host for today's roundtable webinar, Leveraging Practical Tools to Manage Your Opioid Settlement Funds and Heal Communities. The importance of this topic cannot be overstated. The opioid crisis has devastated countless lives in communities. Managing these settlement funds effectively is crucial, and making sure resources reach those in need and creating a lasting positive change is also important.
Exactly, Denisha. Communities will receive over $50 billion from settlement funds to address the harm caused by the opioid overdose crisis. These significant awards present an unprecedented opportunity to alleviate suffering, but they also place a high burden on states and local jurisdictions to effectively leverage and manage these funds for the public good.
And during this webinar, industry experts from RELI Group, MTX Vital Strategies, and Johns Hopkins University will guide you through comprehensive solutions and tools and strategies designed to navigate the complexity of fund management in the context of opioid crisis mitigation. So thank you for joining us, and let's get started. Next slide, please. So now let's take a look at today's agenda. We'll begin introducing our panelists. Following that, we'll dive straight into our panel discussion and an overview of the Osprey tool. We'll wrap up with a quick response from each panelist, and if time permits, we'll open the floor for a short Q&A session. Please feel free to post your questions in the chat, and if we can't address them during our presentation, we will follow up afterwards. Next slide.
I'd like to take a moment now and introduce our panelists. Sarah Whaley joins us from the Bloomberg Overdose Prevention Initiative at Johns Hopkins School of Public Health, where she's the director of programs. She has extensive experience in opioid treatment, harm reduction research, and direct service intervention. In her role, she leverages empirical research to inform policies and programs designed to improve outcomes for individuals who use drugs and their families. Her work is dedicated to advancing evidence-based strategies that enhance public health and support communities affected by the opioid crisis. Also joining us is Eric Hulsey. Eric serves as Senior Technical Advisor, Drug Use Epidemiology and Data with Vital Strategies Overdose Prevention Program. In his role, he supports governmental and community stakeholders to use data and evaluation to inform action. Prior to this role, Eric managed a behavioral health analytics team within a county government agency where he led a team of analysts to ensure the appropriate design, quality, and analysis of health-related data in the largest county's integrated data warehouse. He has nearly 20 years of experience in health and human services, and his expertise lies in evidence-based substance use disorder care and system design, and he has worked in overdose prevention for most of his career. Also joining us is Danielle Chiacco from the RELI Group. Danielle is a project manager at RELI, contributing to the success of the Provider Compliance Group data analysis and statistical sampling and overpayment estimation programs within the CMS Center for Program Integrity. With over 2 decades of professional experience, Danielle has supported the federal government and sectors including security, human rights, and health with significant roles at the Centers for Medicare and Medicaid Services, the U.S. Department of State, and the Organization of American States. Danielle's passion for advocacy has taken her across the globe, supporting development and security in post-conflict societies, advancing women's health initiatives, and promoting organic empowerment methods. Her extensive research spans HIV/AIDS programs, humanitarian aid, preventative health care, war trauma, reintegration of former child soldiers, and women's initiatives. Also joining us is Anna Sommers from the RELI Group. Anna is the Medicaid policy and data lead for RELI. She is a senior health services researcher with over 20 years of experience in conducting mixed methods research and policy analyses for federal clients, the Medicaid and CHIP Payment and Access Commission, state Medicaid agencies, and foundations. Her research is focused on exposing the institutional and programmatic barriers to accessing healthcare for populations eligible for public programs. She recently supported Vital Strategies and the Pew Charitable Trust with technical assistance to states seeking to maximize their use of federal funds to combat the opioid crisis. For 5 years, she supported the CMS evaluation of state Medicaid substance use disorder Section 1115 demonstrations. And as a certified human-centered design practitioner, she led the design of a dashboard for the CMCS to support state responses to the opioid epidemic. Anna continues to seek collaborations with clients to design and execute studies that lead to improvements in access to care and translate complex analyses into concise, policy-relevant insights and action. And finally, we are joined by Paula Flores from MTX. Paula brings 25 years of federal grant management experience in state government. As a certified federal grant manager, she has served in several key positions, including Federal Grants Bureau Chief for the New Mexico Department of Finance and Administration and Federal Grants Manager for the New Mexico Department of Homeland Security and Emergency Management. Her extensive experience in managing federal grants has significantly contributed to the effective allocation and oversight of resources across various state initiatives. Denisha?
Thank you, Amanda. Now that we had a pleasure of introducing our esteemed panelists and giving a glimpse of their impressive backgrounds, it's time to dive in the heart of our discussion. And again, I want to encourage our audience to actively engage with our panelists by submitting your questions. This is an opportunity for all of us to gain insight and share ideas, but more importantly, we brought together a esteemed group of people from different stakeholders to really tackle this multifaceted issue, this opioid crisis. So I begin with our first question from our senior practice associate from Johns Hopkins Bloomberg School of Public Health, Sarah. Sarah, what is the current state of the opioid overdose abatement efforts and settlement funds distribution?
Thanks, Denisha. Before we talk about abatement efforts, I really want to frame us around a few points that you made in the introduction about where we are with the overdose crisis in general. Opioid-related overdoses have continued to climb in this country. We have seen unprecedented numbers where we lost over 100,000 lives, despite all of the advances in treatment, harm reduction, prevention, and recovery. If we were to look at overdose rates alone, it would seem that we're not making any headway. However, the decades that we've been in this crisis has taught us a lot, and there is substantial evidence of what types of abatement strategies work and what types of strategies don't work. So where we are with the opioid settlements, this is a collective term for the proceeds from the lawsuits brought by states, cities, counties, and municipalities against the opioid manufacturers, distributors, and pharmacies for their role in contributing to the overdose crisis. Like you mentioned, this will total around $56 billion to these jurisdictions over the next 18 years. Since 2022, most states have received 3 payments from the distributors, 3 more from Johnson & Johnson, with another set of payments coming in July of this year. More payments from the pharmacies and the other defendants will hit state accounts kind of throughout this time frame. These dollars offer an opportunity for jurisdictions to add additional funds to supplement the existing abatement efforts that they have been investing in, for the last few decades. Unlike the tobacco settlement, which is one that we think of a lot when we're thinking about these like large public health lawsuits, the opioid settlements include some guardrails for how the dollars have to be spent. So where the majority of funds from the tobacco settlements didn't go towards investing in tobacco prevention and cessation programs, the majority of funds from the opioid settlements have to be spent on opioid abatement. The settlement terms allow for a lot of autonomy for the states in their decision making and a lot of flexibility for how they decide to spend the dollars. This flexibility really is an asset and an opportunity for states to look at the scope of the crisis in their jurisdiction, look at their existing efforts and infrastructure, and invest where the funds are most needed. To do this, they have to, and to maximize their funds, they have to have an understanding of what the crisis looks like, what populations are most effective, what programs are already in existence, how they're funded, and what those programs are doing and how well they're doing. All of this information is really rooted in data, and having access to that data, so that this information isn't siloed, and shared effectively with decision makers. So where we are now, as we might know, this like variability with the states really depends on how they understand the scope of their crisis and how they're going to use these dollars intentionally, state by state.
No, thank you, Sarah. I mean, you point out some really clear points there. Who it's going to impact, how they're going to use this funding, and then all of the guidelines, or not so many guidelines, for how they can actually distribute this fund to actually make an impact. I would love to know, Danielle, what is your perspective with how the current climate with the opioid crisis as well?
Well, sure. Thank you, Denisha, and thank you, Sarah, as well. Good afternoon, everyone. So honored to be here. As we discuss the opioid epidemic and we critically think about how best to utilize abatement efforts and funding, we should also remember the very real human impact here. The complexity of this crisis transcends borders, and its impacts can be seen and felt within the fabric of our cities, within the heartlands of our rural communities, and often within our direct social and family circles. As a former diplomatic security specialist and a current international health and development practitioner, I've witnessed the tenacious ways firsthand in which opioids facilitate things like human trafficking, indoctrination of child soldiers, and even war. Critical points emerge here. The opioid crisis is complicated and it's multidimensional, and there isn't a one-size-fits-all solution. The most marginalized populations are often the most impacted, and they are not given an ample voice. Integrating inclusive, equity-based approaches while understanding historical elements, unique needs and vulnerabilities, and lessons learned is vital. According to the National Center for Drug Abuse Statistics, opioids kill more than 136 Americans every day. I'm here not only as a panel participant, I also lost a loved one this year to overdose. Many of you share these heartbreaking stories. Despite intense media coverage, federal legislation, criminal prosecutions, and harm reduction efforts, the opioid crisis permeates. So where do we focus some of our efforts? We continue to compensate states and communities for epidemic expenditures, focusing on primary prevention efforts and research, improvement of multidimensional evidence and data collection. For example, our team here at RELI Group, we focus on a skill called simulation modeling, and it's used to predict data performance and patterns. And we find that that could be a very helpful technique in this discussion. Working to combat stigma and medication access for opioid-related disorders. And finally, as an example, Minnesota has integrated settlement funds into their existing infrastructure to blend their resources. And other states and many local jurisdictions like Nevada and Wisconsin have funded new statewide needs assessments. They've coordinated stakeholder listening sessions, and they've gathered local feedback to ensure that opioid settlement spending is informed by data and local experience. These are some of the ways that we can fuel more coordinated, empowered efforts.
No, thank you for that. I mean, you stated a lot there, right? And I just want to go back and say the simulation model that RELI is able to do, as well, MTX works with manages data. I would just love to piggyback and see, Eric, is there anything that you like to add there in that conversation of what the current state is for the opioid crisis, or even other things that they could that can be done?
Yeah, and thanks for the opportunity. I think, in my experience, and we work with several states, and generally, as someone who's been working in the space a long time, and specifically trying to get decision makers to understand, who is dying, where are they dying, who's disproportionately affected. A lot of times, and I think it probably funnels down, the feds have an understanding, the states have an understanding. When you get down below that, not every jurisdiction, be that a municipality, county, or city, has a health department or has folks who are dedicated to assembling information to feed to decision makers. And so it's very challenging when you don't understand a coroner or a medical examiner, the autopsies they perform, sadly. If you don't know where people are presenting from emergency departments for acute overdoses, or where EMS agencies are dispatching first responders, you know, um, um, in response to an overdose in a community, it's very difficult to understand what is going on. And the same would go for the healthcare and prevention space. Just where are these programs happening? What are they? To what extent are they aligned with what we know to be effective? So I'd say that current state is really mixed, but I think it's very challenging for counties to understand basic epidemiology of health, the condition.
No, that's a great point. And he also stated actually some specific problems, right? Where do you go? Where do you start with the hospital, et cetera? And that leads to my next question. My next question is, what specific problems are states and counties facing with opioid overdose abatement? And Sarah, would you mind taking us through some specific problems that you may have seen firsthand?
Absolutely, Denisha. So specifically related to the opioid settlements, like I mentioned, there are some guardrails in the settlements, in the settlement terms about how states and local governments have to spend their money. And kind of the first one is around this like decision making and flexibility about who controls the money. So like the first problem, or maybe not even problem, but like the first complication, right, is figuring out who's controlling this like allocation. So within the settlement, there's a default allocation that is kind of more state centric. 85% of the funds that the state receives will be controlled by the state. But there's an opportunity to change this default allocation. So in some instances, we've seen that default allocation flipped. So in North Carolina, for example, the majority of the funds will be overseen by the local governments. In other jurisdictions, there's, a more equitable split. In Indiana, there's a 50-50 split. And then other jurisdictions have kind of changed this altogether, where funds are controlled by either a special fund, like in Virginia, or in a foundation, like in West Virginia. So kind of knowing where the funds are and who is in control of them, I think is an interesting point that Eric just made in the last question around like data sharing and like who knows. And so when the state and local governments both have these settlement funds to make abatement investments, knowing what the state is doing, knowing what the county is doing, knowing what the city and the municipalities are doing, right? That communication of what these investments are is going to be really crucial. Going back to kind of this like flexibility of how the dollars are spent is an asset and an opportunity, because we can use the funds on things that maybe some other funding sources can't be used on. But that also leaves the door really open for money to be used on a lot of things, and that can be good and bad things, right? So knowing what again, going back to like what we talked about in the last question, knowing what the scope of the crisis is, what existing efforts and infrastructure exists, I think again is like a challenge that state and local governments are facing to figure out where these dollars can be maximized. And again, just like what the crisis looks like Eric said, what are the populations that are most effective? This funding source is, it's finite, and it's not as much as we think. So some of these jurisdictions, some of the counties aren't getting very much money at all. So really thinking about if there is a special population that could use additional funding, if there's a program that's really successful, they might know how to maximize the money more. And again, just thinking about this like information silo and how we can kind of break some of that down and make sure we're not duplicating efforts and putting the dollars like where they really need to go.
No, that's actually a great point. we assume, right, $56 billion is a lot, but when you break it down, like you said, some of these, counties or other organizations are not getting a lot of funding to necessarily continue to program or maximize their efforts, I would say. The other part that you stated was that, there's additional challenges, right? Not just with the fact that we're understanding that their funding may not be as large as they would hope, but also that, specifically that data kind of sits alone. It sits separately from everyone else. And so you can't necessarily maximize that if we continue not to share data. But I would love to know more, Anna, about what additional challenges, other than what Sarah stated, or if you want to clarify what Sarah stated about the concept of, us not sharing that data. The money is not infinite, and how do we maximize those efforts?
Yeah, thank you, Denisha, for that question. I mean, one challenge here is just figuring out how to maximize the impact of opioid abatement, right? There's so many competing needs in under-resourced communities, and that's going to present risk to that objective that communities really need to keep their eye on. That's why the guardrails on abatement are important. For instance, one risk is that settlement funds could be channeled toward large projects with lots of political backing, but with little or no benefit to those harmed by the opioid epidemic. So those funds are diverted. Another risk is replacement, that there may be pressure to replace state revenues covering existing programs with settlement funds. But again, this is yielding no added benefit to communities. And hopefully the guardrails will clamp down on those potential risks. But another one is fraud. So even within guardrails, bad actors may enter the community with the intent to defraud the government or defraud the people who need addiction services. We saw that during the COVID-19 pandemic with the distribution of government funds for free COVID testing kits, where there were few guardrails. And bad actors running call centers duped Medicare beneficiaries into ordering test kits through them. The bad actors defrauded Medicare, and Medicare beneficiaries were harmed because they had their beneficiary ID stolen and they never received their testing kits. So these are all reasons to improve on the guardrails and establish a strong framework monitoring system, which my colleague Danielle will discuss later. But from my point of view, to maximize the impact of abatement, a critical first step is to understand where existing federal revenue is supporting services in your state and assess, are those funding streams being fully leveraged? For instance, check that your state is fully leveraging Medicaid authorities. Historically, Medicaid has prohibited the use of federal matching dollars for things like rent, food, and other services that impact people's health and ability to recover from an opioid addiction, but are not healthcare services. This has changed recently. The Centers for Medicare and Medicaid Services is authorizing use of federal dollars for non-medical services and supports. So some examples of supports that are recently authorized under Section 1115 demonstrations include one-time housing transition and moving costs, such as security deposits, up to 6 months of short-term post-transition housing, sobering centers, home-delivered meals, or pantry stocking. Now, some of these services are limited to individuals at high risk, such as pregnant women, and dollars are capped. But this is an example of where state government can fully leverage federal resources as a first step before even dipping into settlement funds.
No, I like that you gave us actual examples, and how sometimes we kind of miss the mark by not just checking and seeing those policies and funding that exist already. I know for a fact, Paula, that you worked with a lot of funding different services within New Mexico. Would you like to add some more clarifying points here?
Absolutely. What I would like to say is that looking at this from a state and local effort, it's really important to remember that fund management has to run in tandem with policy and program decisions. So in my role as a grant manager at the state level for 25 years, I can attest to the fact that those successful programs keep this effort at the center of their operations, that communication is key.
Thank you, Paula. With you stating that that it needs to be in tandem with each other. That leads to my next question that I would love for you to answer as well. What are the primary obstacles in the process of dispersing settlement funds to the state and counties, especially with your expertise?
I think that every government employee attending this webinar can recall media coverage from tobacco settlements or even 9/11 emergency funding, where those windfall amounts were spent outside of allowable areas. So, as a grant manager, I can't stress enough the importance of having a reliable grant management system or a fund management system to ensure accountability of fund expenditures, as well as ensuring program requirements line up with fiscal spending. So, here at MTX, we've developed that grant management solution on a Salesforce platform. And this is really important to focus on managing those windfall funds and ensuring accountability for all of your program requirements.
Thank you, Paula. And just like you stated, the state and counties need to manage their funds. Sarah, would you mind if there's any other obstacles that need to be addressed as well? You mind answering that question as well?
Yeah, so I think Paula brings up some really great points about, managing these grants. And what we're seeing with this new funding source of opioid settlements is a lot of jurisdictions are having to set up entirely new processes, this entirely new infrastructure to get the dollars out the door. So there isn't, in a lot of cases, like an existing roadmap for this. So some jurisdictions have a single person making the decisions of where the money goes. Other jurisdictions have set up advisory or decision-making committees. I think Danielle gave us an example of a jurisdiction that used existing infrastructure, and another one I'd like to add is Minnesota. So kind of to address some of the concerns or the obstacles that we've talked about in the previous questions, Minnesota used their existing opioid oversight board, and they're overseeing this funding source as well. So rather than starting kind of a new process, they kind of just funneled it into what was already happening. But that's not the case in a lot of jurisdictions. So we're seeing kind of this competing priority where jurisdictions want to get money out the door. They want to address this crisis now, but they're having to set up the processes to make sure that the decisions are good decisions. And with all of the flexibility, like this is going to take time, right, to kind of see where the dollars should go, while also setting up a board, appointing members, setting up, just like what the process will look like. So, and just to add some like clarity on like the guardrails, while the settlement does give a list of 9 core strategies and then a really long list of approved uses in Exhibit E, a lot of this is like really vague. And again, that's great because we can leverage the dollars in really like exciting ways that like other funding sources can't be used for. But it also leaves the door like wide open for interpretation of like what abatement means. And so again, like at JHU, we've put out some great recommendation on our website. We'll talk a little bit more about those recommendations. But really, I think thinking about how we can root the decisions for opioid settlement dollars and the process kind of in some core principles, looking at where the dollars can be maximized to save lives now.
You made a few good points there that I would love to just add on to. I know here at MTX, especially during COVID-19, we really made sure to work with our state and county officials to maximize that COVID funding or that ARPA funding that came through the door. And I know Amanda can talk about this a little bit more, but how even childcare through the ARPA funding, how we were able to some states reopen or expand their services with that additional funding, or utilize different funding that was also that was given during the COVID-19 correspondence. But not to take too much of that, Amanda, would you like to add anything there?
Actually, Denisha, thank you. Yeah, you're right. I was just thinking about the ACA implementation. You know, that takes us back like 10, 15 years now. But the way that the guidance was issued, it was also very open to interpretation. And I live in Maryland. So just as an example, in Maryland, we reviewed all of our Medicaid programs and we collapsed them. We simplified everything and allowed, health and insurance coverage for single people, for homeless people, like many states did, like leveraging it to the absolute maximum. So I agree with Sarah, the vagueness of the guidelines and the guardrails, the 9 core, it's very familiar from my work with the ACA, but those 9 core tenets, it's very much allowing states to really look and get creative. And I love that.
No, that's great. And just to add, as the states get creative, this goes back to what Sarah and I think everyone else on the panel was discussing. And we need to strategize. We need to share that data. And the more information we have, the better that we can get at maximizing our efforts with that funding, which leads to my next question. What opportunities do these settlement funds present for states and counties in addressing the opioid crisis? And Anna, would you mind tackling that question first?
Yeah, sure. Thank you for that question, Denisha. Yeah, I'll just piggyback and expand on some of the points that others have made. The settlement funds can play a unique role because they have fewer restrictions than Medicaid, SAMHSA, CDC block grants, which have these strict parameters on what programs and populations can be funded. So this creates the opportunity to fill holes in the service continuum that can't be filled by other sources. So what gaps can they fill? I mean, some that I'm aware of that I've heard are much needed at the state level are an obvious gap is simply to fill is services for people who don't qualify for Medicaid in your state, right? And block grants do that as well. So outreach and services for the uninsured and underinsured. But in addition, the providers of these services, they typically operate with skeletal staff. They rely 1 year to the next on grants. So giving these providers predictable multi-year revenue, conditional on meeting certain milestones that correspond to these guardrails, could support long-term planning and retention of experienced staff, which is a big issue, the burnout and the turnover. Another gap is the brick and mortar capacity. Medicaid and most federal funders will not finance brick and mortar projects. So this could mean new housing units to support people while in recovery or transitioning from institutions or carceral facilities. It could mean permits for new sites or expansion of existing facilities. Communities also contend with workforce shortages to treat addiction. So another opportunity is to encourage entry into the workforce with tuition repayment or tuition subsidy programs for community residents. But these are all just suggestions, and your state may impose certain restrictions on eligible activities, but this is where your population needs assessment, your gap assessments, and community voices should inform priorities.
No, thank you, because that's also great. I mean, I know MTX and I know Amanda, you can add to this a little bit, but vocational rehab, we have a solution for that. When you're talking about replenishing and giving, and how do we utilize or what they should go after, right? All those things that you specified. I know that there are key vendors or the data scientists, you name it, like RELI or MTX, that can assist with that strategy, those objectives and outcome measurements. But I also want to add, or I would want to ask is that, Danielle, is there anything that you want to add to that before I bring it right back to Amanda to just talk about some of like the health and how health and human services intertwine, and where things like vocational rehab or housing applications, things that we already do now, and how that can be applied to opioids? Danielle, would you mind going first?
Sure, Denisha, thank you so much. So we have this unprecedented opportunity for these funds. We've already talked about that at length. But as we've all discussed, a major challenge is the ambiguity of how and where to concentrate the funds. So here's where a helpful framework monitoring system can impact. It can offer principles to apply to assist states and counties with their focus while ensuring that community needs are met. The framework can be standardized, it can be scalable, it can be politically viable and sustainable without adding report burden. right? So it can also enhance, most importantly, things that we've discussed today, like cross-communication, knowledge sharing, risk mitigation, and transparency, while relying on the inherent strengths that already exist within states and counties. So let's remember that, when we're talking about these things. And also, most vital, it can shine the light on structural inequalities and health disparities that have already historically fueled this crisis. So the monitoring framework that I'm referencing consists of 6 basic nodes. So number 1 is identification of the issue, which we've all been doing today, clearly. A development of metrics, which is the second. The third will be your monitoring phase. The fourth would be your evaluation phase. Then you would wind down with your recommendations and then your feedback. And that cycle would continue. So, for example, at RELI Group, we have data analysts that use predictive modeling, and that predicts adverse outcomes. And this kind of knowledge can be used to identify these regional areas where support is needed most, while taking into account the historical and demographic issues that I've referenced. Another technique that we use at RELI is machine learning, and that can also be integrated. For example, it can be used to integrate data sets composed of publicly available information. So predictive modeling can support a funds distribution formula that focuses on data points, and some of those data points can be looking at things like number of overdose deaths within states and counties, opioid disbursement rates per state and county, and prevalence of secondary health issues related to that opioid addiction. And one thing I did kind of want to close out in the conversation as well, we've made a lot of reference about the tobacco settlement. We've all been around, we have quite a memory there, right? That is a reflection of an absence of a framework monitoring system, right? So you had a $200 billion settlement, but less than 10% of the funding was actually used for tobacco control efforts, right? So those funds went to places like state debts, road reconstruction, and tax reduction that benefited directly from the funds. However, in some circumstances, those funds were even actually used to subsidize tobacco farming. So in all, investing in a framework monitoring system can help deter these types of risks that we've all been talking about. Repeating our past mistakes, right? That's something we want to focus on. Reporting measures will fuel more comprehensive initiatives and standards by tracking changing needs and ensuring that those most marginalized get the assistance they need. So by surveying state and county needs, you're really engaging these diverse stakeholders that we're referencing and these support specialists, right? And then you're also participating in community engagement campaigns, right? So we can fuel this monitoring system that is risk averse and impactful. This is how I believe we begin to start optimizing our targeting strategies and focusing on good fiscal stewardship and equity-based solutions that will save lives.
No, that's amazing, because when we don't have framework or proper strategy around what to do with funding, just like with any company, it will fall short from the outcomes that we are trying to achieve here. Giovanni, will you cue the next slide for me? Because that brings up a clear point that I want to make sure we spend some time on. I would like if Sarah can really discuss the Osprey tool. So the question I have for you, Sarah, and of course, Eric as well, what guidance and resources are available to help states and counties create processes for distributing these funds effectively? I know Danielle touched on that the importance of framework, but Sarah, would you mind explaining what's there and what's important and what they should be utilizing here?
Yeah, so Eric's going to guide us through Osprey, but before we get there, Osprey is framed around these principles that the Johns Hopkins team released in late 2020. They are a set of 5 foundational process level principles to help state and local governments plan for the receipt and spending of their opioid settlement funds. So again, like really scaling back to like building this structure and infrastructure for making those informed spending decisions. These principles were developed by experts from across the opioid abatement space across the country and have since been endorsed by over 60 national organizations as the national standard for planning for opioid settlement funds. Again, these principles are high level, and many of them are things that we've mentioned already in this conversation. So spending the money to save lives, making sure we're not spending it on things that we know don't work, Using evidence to guide the spending, we again have a large resource and knowledge base on what programs are backed by evidence and what programs have been shown not to work. So really using that evidence to guide the spending. Investing in youth prevention, a good public health approach also has a primary prevention part. Focusing on racial equity, that's something that Danielle just mentioned, making sure that these dollars are going to the communities that have been disproportionately impacted by this crisis. And then the last principle is like another theme that we've talked about a lot today, which is creating a fair and transparent process for how the funds are allocated. So since the initial release of these principles in 2020, we've launched a website. It's opioidprinciples.jhsph.edu, where we continue to release and link to resources to help jurisdictions plan for and spend their opioid settlement funds. One of these resources is our OSPRI tool. This tool was developed directly in response to a need that we heard from states and local governments as they were making their decisions. They were curious and wanted kind of a set of indicators to monitor the programs that they selected to fund, so the program services or interventions, to make sure that these investments had the intended results. So I'm going to kick it over to Eric to tell us more about the tool and how to use it.
Thanks, Sarah. Can you hear me okay? Okay, good. So just as Sarah said, this is one of the tools that is based on the settlement principles and using the money to save lives, as well as using evidence to guide decision making. We heard this from counties, from states, thinking about what to do, but also how to know you're effective. And so we thought about creating an accessible, not too fancy in terms of very complicated, but for the audience we thought might use it, an ability to select from, once you know what's going on in your community or what you might want to do, this tool will guide you to a set of indicators. And when we say indicators, things that'll help you count, something that'll help you keep track of what is changing. We always say most county, state, and as well the federal government is not really controlling substances coming into the country or to a community. You don't control the drug supply. You don't control all these things that are increasing overdose risks. But a jurisdiction can choose how it responds. And so what we put into this tool is reflecting that. And it includes a sample, and we say this is not an exhaustive list, but it has a sample of activities or interventions a community can choose, and it helps you narrow down on the specific thing or setting you want to work in, and then renders a list for you to select from that can guide your planning. So when you land on you should go check out the settlement principles, and when you're there, you can visit this tool. And if you look at these number bubbles on the slide here, what it does is guide the end user through a few selections. So we lined up one of these intervention strategies with the core abatement strategies, many of which are listed in Exhibit E of the settlement agreement, although each state is going to vary a little bit. But generally, these are things that are promising or evidence-based strategies known to have some ability to reduce overdose risks. We also put it in real folks terms and called it a key performance question, or sort of what do you want to change? So if you look at number one, you make one of those two selections. You could select the kind of thing are we expanding naloxone to people who are most vulnerable to overdose? Those kinds of things. Secondly, you can select a setting where an activity or intervention will be implemented. Is it a hospital? Is it a school? Is it a general community? As well as a continuum. Is it prevention? Is it harm reduction? Is it treatment? Is it recovery? Where you're planning to implement this intervention. And you make a few of those selections, And what will happen is it will generate a table for the user and you could print that out. Eventually, it's not there yet, but you'll be able to print that out and take it away and engage your colleagues to decide on what you're going to do with that. So encourage you to check this tool out and see if it doesn't help you make some of those decisions.
No, thank you, Eric. That's just one tool that we can utilize. And as I think MTX and RELI are stating that you you put all the tools together and you can really maximize the effort and make a difference in impacting the community. This is just the first strategy. Where do you go? Where do you start ideally? Anna, would you like to bridge the gap between the Osprey tool, the framework, and what MTX and RELI can do together when it comes to these measurement tools?
Yeah, so bringing it all together, the Osprey it's a portfolio of measurement tools that correspond to the settlement principles that communities could select from to count what is important to them. It's not necessary to count everything, but count what is important to you. Counting services, touch points, individuals reached, those are all important to demonstrate value to even new funders who may help to sustain infrastructure and activities supported by the opioid abatement. And then Danielle's point is that measurement should be informed by a framework monitoring system that has organically been developed out of your community and which establishes the objectives for monitoring. And the point I'm taking away also from this is that neither of these things are static. Tracking changing needs is critical for this crisis because, as Eric said, the drug supply keeps changing, introducing new risks, which requires new interventions. So I think that we could all agree that this work is best done by bringing together diverse stakeholders into regional partnerships, whatever you want to call them, that leverage knowledge and technical experts. But there is a risk that in any process that brings together stakeholders, that the balance of power can shift away from those with the least political leverage. And so accountability needs to be embedded in these partnerships.
And I really like how you just segued into the next question, because we talked about the problems or the current landscape that's happening right now with the opioid crisis and the distribution of funds. And then we talk about tools and framework on how to guide, states and counties on how to maximize their effort. But then it goes back to that one question, right? Like, what can states create? How can states create accountability in the use of settlement funds? And if you don't mind, Paula, would you mind, because as you worked in the state, I would love to know your perspective on how the states can create accountability within the distribution of these funds.
Absolutely. So in my final position with the state of New Mexico, and most recently with pandemic funding, it was extremely important for us to ensure both programmatic and fiscal accountability for every dollar received by the state. Monitoring and reporting elements were specifically built into the grant management solution by MTX, as well as a public-facing dashboard that was extremely user-friendly for Joe Citizen, the media, and as well as legislative and executive staff members to have that ability on a daily basis to look at each state agency and where they were sending the funding and who it was impacting, and maybe even where it was sitting and not being utilized correctly. All of that accountability is really important for states when making decisions as far as where will the next segue of funding go. And, as the opioid abatement funds start to impact state and local governments, it will absolutely behoove those government agencies to begin their internal processes and potential system development with those accountability levels in mind to minimize fraud, waste, and abuse.
We definitely want to continue to minimize the fraud, waste, and abuse, and we also want to make sure we hold the state and county officials accountable to distribute these funds to the communities that are most impacted by the opioid crisis. Danielle, would you like to provide some focal points within how to hold accountability as well?
Sure, Denisha and team. So there are 3 focal points I'd kind of like to discuss centering around accountability and reporting practices especially with reference to that framework monitoring system that I've been discussing. So one is reporting practices should promote an informed demand for effective policies and interventions. So what that means is we know that an examination of historical national policies to curb drug misuse and addiction haven't always worked, right? So wrong solutions equaling wrong ideas about the problem. Perception and management of substance use disorders has overwhelmingly, and I've already talked about this, right, impacted the low-income communities, communities of color, and rural areas. So information should be factual and accessible to social workers, to folks like healthcare workers, those in education, and public officials. So implementing also sort of like these public awareness campaigns when integrating reporting measures is also vital. Data-driven policies are also key to effective reporting, like we've continuously mentioned, as well as the integration of reporting protocols to report and mitigate risk, and then reporting expectations that shouldn't be placing undue burden, again, on system users. Number two, standardization of reporting mechanisms, focusing on evidence-based prevention services and early intervention strategies. So this could really impact beneficially the trajectory of the funds. With the creation and maintenance of state prevention offices, states can then focus on that organic empowerment and those initiatives that work best for their own states. Some states have begun to already create these monetary incentives for effective reporting protocols. The intent is to sort of strengthen this preventative social service and community organization network. So as an example, we can talk about things like adolescent access reduction and exposure, prenatal care to opioid addicted mothers and other vulnerable populations. So accountability also ensuring that there are periodic reviews of the reporting tools, user experience can be reported and looked at, resource capacity, things like user burden and ease of communication, and then the mitigation strategies come in. So also incentivizing users to employ these accurate methods for reporting and monitoring funds distribution would have a long-term successful impact. And the last point I'd like to make also is that reporting practices should underscore the integration of equity-based standards as mainstream. And I've mentioned that a few times this afternoon. So an accountable framework should be robust enough to evolve with the needs and current advances of states and counties. So the realization that many states and counties are operating within a fundamentally inadequate and under-resourced system should drive the need for more multifaceted integrative approaches. For example, enhanced training and collective support, increased capacity and availability of comprehensive treatment options for opioid addiction, with the balance of awareness of safe prescription use, for instance, for chronic pain, staff expansion for reporting, and educational incentives for, via, for example, Medicaid and block grant funds we've talked about, those enhance reimbursement for these evidence-based treatment programs. So overall, the review and assurance that reporting technology is current and robust, but that the ongoing investment, right, underscoring that term investment of enhanced peer, state, and community reporting measures.
No, thank you, Danielle. And honestly, we're almost at the top of the hour here, and that hour of this webinar went by so fast with the wealth of information that each of you have given us. But before we say our goodbyes and wrap up, I at least want to ask one more question to each of you panelists. If you could just take the last 60 seconds, 30 seconds to 60 seconds or so to answer this one question. What should states and counties focus on or take away from this webinar? And what would be the best starting point for them? And would you mind, Giovanni, going to the contact details? And then, Paula, would you mind starting off the answer to that question? And again, let me repeat the question. What should states and counties focus on or take away from this webinar? Or where should they start from?
Thank you. I think that, new funding streams will inevitably bring out potential areas of fraud. So ensure that you have the appropriate fund management system in place to guard both the funds and expenditure expectations, as well as programmatic requirements and data and metric gathering. Lean toward proven expertise when selecting a fund management system or platform. Set your program up for success with full lifecycle management from an industry leader with trusted experience.
Thank you, Paula. Sarah?
So I want to kind of center our last thought around this idea of accountability and transparency, and just acknowledge the difficulty and the challenges that jurisdictions have had in setting up these new systems from scratch, these new processes from scratch, and just kind of root us all in giving each other some grace as we navigate this new space. And when we think about accountability, really thinking about accountability in terms of transparency. So being transparent kind of all the way through that process about the amount of money received, how the funds were spent, on what and why, and what kind of the goal of that investment was. So what the program was hoping to solve. And there are tools and resources that you've heard about on this webinar to kind of help each jurisdiction as they navigate that and root kind of their development of this new process in transparency. And so just knowing that there are groups and resources that are here for support, but really thinking about how we can set up and focus on that clear, transparent process that's rooted in solutions to solve this problem.
Thank you, Sarah. Danielle?
Sure. And thank you, everyone, as well. Just sort of covering that focus on multilateral partnerships, right? That again, the transparency, the inclusive communication, and the integration of sustainable reporting and monitoring system frameworks. These things can really bring us closer to combating the opioid crisis. We know there's not a quick fix, but we also know we're in this together. And if we recall, right, we take a moment, like I said at the beginning, that this is a human issue, we reflect upon that. That requires a humanistic approach. So we can continue to focus on what matters. So relying on existing technical expertise, like many of our colleagues have talked about today, even like what we do here at RELI Group on the level of data management and predictive analytics, we can strengthen our partnerships. We can empower ourselves and our communities. And most importantly, we can reimagine a world free of opioid addiction and overdose, a world that honors the value of every human life for future generations to come.
Thank you, Danielle. Eric?
I think there's a reason I get to work with Sarah Whaley. She said pretty much what I would say, but just to emphasize that there are resources and tools that exist today that a county, a state, a municipality, if they're looking for them, these are great places to start.
Thank you. Anna?
Sure. Thanks, Denisha. This is a lot to figure out, but I think the point we're all trying to make is that it doesn't have to be overwhelming, that there are resources that are out there. First, maximize federal revenues before dipping into settlement funds. Second, bring in the technical and knowledge experts. Draw on the resources and expertise at your state universities, at regional foundations. Draw on the tools presented here. Third, contract for technical capabilities to support effective management and monitoring of settlement abatement, and choose vendors who are responsive to community objectives. And then finally, leverage these resources to support, but not supplant the community level decision making. Instead, find ways to elevate the diversity of voices of those least empowered and most impacted by the opioid epidemic and its fallout.
Thank you, Anna. Amanda?
I just want to thank all the panelists. I think this has been such a great conversation, and I feel like there's so much more to cover. So maybe we'll do it again sometime. But thank you, everybody, for joining us and for participating. It's really been a pleasure. This has been a really spirited discussion, and I found it invaluable. So thanks.